So on to how effective communication can be improved with patients. Effective communication between a nurse and patients must be patient-centered, right? Understanding the patient's viewpoint of health and illness and being able to empathize are important components of patient-centered communication. The nurse must also explore the patient's feelings, ideas, concerns, and life experiences surrounding their health and illness. Engaging in patient-centered communication requires learning skills by the nurse, which include eliciting the patient's agenda, motivational interviewing, using plain language, health literacy considerations, ask to tell, considering what the patient wants and needs. So eliciting the patient's agenda is a learned skill done by first introducing and acknowledging all of the persons in the room, both medical and non-medical, and determining the relationship with the patient. Use open-ended questions such as, how can I help you today? And what care are you seeking today? On average, for example, a health provider interrupts a patient within 16 seconds of asking an open-ended question. So it is very important, that allowing a patient to speak creates an atmosphere of non-judgmental acceptance and often provides valuable information leading to a diagnosis. So give them ample time to answer all of your questions. Moving forward, the skill of motivational interviewing is a communication approach used to promote patient engagement. So communication techniques used in motivational interviewing are designed to promote care management strategies. Examples of these techniques are open-ended questions, affirmations, reflective listening, and summary statement. We already spoke a little bit about some of these techniques. Utilizing such techniques helps to build supportive relationships between the patient and the nurse. The use of plain language is also a learned skill that avoids the use of medical jargon and instead encourages the use of everyday examples to explain medical terms, and also includes asking patients to describe their medical concerns in their own way. That way we ensure that there is direct communication and everybody here is understanding. That is in the direct environment of the patient. For effective communication, the nurse must also consider the health literacy of the patient. Health literacy is the ability to understand and take action when receiving health-related information. Being health literate improves the preventative health effort and quality of life for the patient. Providing information in a manner that is understandable to the patient is a major element to effective communication. The ask to tell skill is a collaborative communication method which focuses on asking patients what they are willing to do versus a directive method which tells the patient what to do. An example of this is the use of teach-back. We're all familiar with teach-back. Teach-back is a communication method that involves asking the patient to repeat back in their own words what they need to know or need to do, right? This method allows for clarification and validation of the delivery and understanding of health information in a non-threatening way. Lastly, a skill that improves communication with patients is respecting the patient's wants, beliefs, and needs. The use of interpreters for language barriers, an example, visual aids for explanation of complex health information, and communicating in short amounts of time, focusing on one or two topics, are skills that help express respect for the patient, wants, and needs. By learning these skills as nurses, we improve our communication with patients and enhance patient-centered care.